Guys, so we'll quickly look at the next type of porphyria. This is what is known as what Porphyria Cutanea Tarda. Porphyria Cutanea Tarda. Alright. So for this Porphyria Cutanea Tarda, you see how they actually affect your nails, right? I couldn't actually bring other pictures here because they were so scary. Okay. So that is the most common type of porphyria, and its primarily affects the skin. Cutaneous. Alright. So it's caused by what? A deficiency of the enzyme known as what? Uroporphyrinogen decarboxylase. Right? Uroporphyrinogen decarboxylase. And this enzyme is involved in the heme synthesis pathway. Right? Uroporphyrinogen decarboxylase. Right? So you have a problem with this enzyme. Okay, you have a problem with this enzyme. Okay, so you could say that porphyrinogen is not being converted to what? Porphyrinogen. You understand? So that means you basically have an accumulation of all these precursors at the back. You get? So key features is such an individual will be photosensitive, be sensitive to sunlight. The skin manifestation is basically blisters, okay, post-inflammatory pigmentation, increased sensitivity to sunlight. You understand? Urine color. So the urine color may become reddish or tea colored due to the increased excretion of porphyrins. Chronic liver diseases. Such individuals will be having chronic liver diseases, right? Then possible triggers, okay, that could actually be putting such an individual into episodes could be maybe alcohol consumption, hepatitis, iron overload, estrogen therapy. Then some certain medications can now exacerbate the symptoms, right? So diagnosis and management is it is diagnosed through what? Blood and urine and stool tests just to dictate abnormal levels of porphyrins and their precursors, right? Then also genetic testing to see if there's what? Mutations in the UROD gene. So management is just focus on you are trying to avoid the triggers. So most people they have this disease condition, but the sleeping dog is actually lying. Alright, is when they encounter those triggers that's usually the problem. Okay, so avoid the triggers, protect such an individual from sunlight, and managing symptoms with medications such as anti-malarials, iron chelators, and all of that. Okay, so in severe cases, phlebotomy, removal of blood may be used just to reduce the iron levels. Okay, so that's it for Porphyria Cutanea Tarda.